Everybody, there's the wave that Amber, my wife, makes fun of me for on videos. I'm Dr. Bupp, and we're here at Advanced Health Wellness Center.
I'm Leah Klein.
And Leah. And Leah is our regenerative medicine specialist, our joint rejuvenation specialist. So we have put together a program. We've revamped it over the time, I don't know what you call it, the COVID something or other. We revamped our program, our regenerative medicine program, our joint rejuvenation program, and we've added some really cool things into the mix and things that would help our patients, and also some things that were covered by insurance that we know is very valuable and beneficial to our patients, so that we can actually lower the out-of-pocket cost and deliver more. So we're pretty excited about that. Phase one of the program was increasing lubrication and joint mobility and decreasing inflammation, in case you missed this. Phase two was increasing stability and working on joint positioning and alignment. And then phase three is what we're talking about today, which is really, really exciting. So once we have a joint that's working well and moving better, has less inflammation, again, this is why I think this program works so great and even better than it did in the past, is because now we have a joint that's prepped. So those other two phases are kind of preparatory to now phase three, which is our actually the regeneration phase, and there's some products that we use that help support the body's natural ability to repair itself. So do you want to talk about those?
Sure. Yeah, I mean, it's depending on your problem, your body, and your exam, and our findings and our recommendations, there's a number of different things that we could do that would be types of regenerative therapies. So one of those being umbilical tissue. We use umbilical cord tissue as a regenerative medicine injection. So that contains collagen, growth factors, amino acids, hyaluronic acid, stem cells. So that's kind of our, big heavy hitter for somebody that has a chronic degenerative joint. Other options are PRP, which is platelet-rich plasma. That's your own growth factors and healing cells of your blood. So we draw your blood and we spin it down, and then we inject platelet-rich plasma back into the joint that we'd be treating.
So how do those things work? What's the basis premise for how they work?
They work by signaling all the cells of your own body to come heal this knee or come heal this shoulder, and then the umbilical tissue specifically has all those other additives that are like just speeding it along, making it work better, adding the lubrication, your body's doing the healing, and we're giving it all these other great nutrients.
So the resources, so there's nothing actually added to it, it's just straight umbilical. It's the Wharton's jelly part of the umbilical cord, so it's not the membrane, and it's also not the vein and artery. It's aseptic. And
contains all those things naturally on its own.
Yeah, it contains those things naturally. And we go into detail, and we're going to go into detail about the testing that's done on the tissue to make sure that it's aseptic and it can't transmit any viruses or bacteria within the tissue. And the screening process, the labs are registered with the FDA, and they're inspected by the FDA. PRP comes from your own blood, except that it doesn't work as good from a arthritic degenerative joint standpoint as it does a muscle or tendon issue. So isn't it true that a big part of this process is based on, the success is based on doing a really thorough and complete exam?
Definitely. The exam's the most important, because the exam, the x-ray, the chronic state of your problem, the things that you've tried and done in the past that did or didn't work, we use all of that information to give you your best recommendation.
Yeah, so based on those findings, then we can determine what is actually going to be, what's going to give the person the best chance of getting better, right?
Definitely.
And without that, so it's not a one-size-fits-all program. It's not like how much is that? Well, it's different for everybody. So we're going to go into detail with that next Thursday?
Tuesday,
Next Tuesday.
August 11th at 6:30.
Next Tuesday, August 11th at 6:30, we're doing a webinar. And the link will be there for you to register. It is limited to a certain number of people, so we're able to interact well. And so the sooner you register, the more likely it is that you'll be able to get on there. And yeah, we're going to go into detail and give you exactly what we're looking for in this program and how it can help. Anything else?
No, sounds great. Log on.
Cool. Have a great day. Let's talk to you soon.
Bye.